I'm trying to understand what this means in practical terms for your average senior. And so as I listened to Cheryl's testimony and noted that she's 54 years old, I'm 54 years old, and had contributed, obviously, as we all do in our paychecks, and I was enthusiastic to look at that every week too. And so now, having worked all this time, since I was about 14 years old, regularly every year, I now know that I'm going to have to put in some more in addition to what I've already saved. And so is it really true that at 54 that I could expect that I will have to save between now and then, in addition to saving for my retirement, that I will have to save about $60,000 in order to meet the costs? Can you say it louder in the microphone?
Bottom line, the Congressional Budget Office estimated that the proposal first advanced in 2011. Medicare now pays 70% of beneficiary expenses. It would only pay 32% of beneficiary expenses, so you can just see how much you have to make.
So in 11 years, I will have to save $60,000 in addition to my private savings that I had for to match my Social Security for retirement, a third of which I lost under the economic policies of the last administration. So you're telling me that over the next 11 years that I have to make up what I lost on my private retirement plus $60,000 a year. How is it possible for average Americans to do that?
Well, I think you're exactly right that the value of savings have eroded, been wiped out, particularly people who've lost jobs, haven't been able to get another job. They go into retirement without a secure base. If they have to live on their Social Security checks, half of those checks would have to go for health care expenses and premiums.
And so just so that I really do understand that, I just have one child, and he's now 24, and by my calculations, he would also have to save about $360,000 in addition, because he's only a one child, to taking care of me in my retirement. How does this plan not just gut not only my retirement, but the retirement of future generations too?
Representative Edwards, I think you're speaking to exactly why Medicare was enacted in 1965. And what's being proposed is sunsetting. I've heard that phrase. We need to sunset Medicare. I've even heard it referred by a candidate in my state to sunset both Medicare and Social Security. And this is why you have exactly expressed why we enacted Medicare in 1965. Because the private market doesn't serve, and you really can't provide the savings necessary.
Thanks. I just wanted to try to understand this in really plain language. I appreciate you.